If you're over 50 and noticing your trips to the loo are increasing, especially at night, it might not be cancer. It could be something very common and treatable, benign prostatic hyperplasia, or BPH. BPH is a non-cancerous enlargement of the prostate gland that happens naturally with age. The prostate sits just below your bladder, wrapping around the urethra like a donut. As it enlarges, it squeezes the urethra, making urination more difficult. It is extremely common. Around 40% of men in their 50s and over 70% of men in their 70s have some symptoms of BPH. The prostate's growth is influenced by male hormones, particularly dihydrotestosterone, or DHT, which is converted from testosterone by the enzyme 5-alpha reductase. With age, hormonal changes and cell growth patterns cause the gland to enlarge. This is not cancer and doesn't turn into cancer, but the symptoms can be very similar. BPH can cause both obstructive and irritative symptoms like weak urine stream, difficulty starting urination, dribbling at the end, feeling that the bladder isn't fully empty, or frequent urination, especially at night, and urgency to urinate. These symptoms are measured using the International Prostate Symptom Score, or IPSS, a questionnaire that your GP might use. So when should you seek help? If you're waking multiple times at night, finding your daily activities affected, or if you notice blood in your urine, pain, or sudden inability to pass urine, you should see your GP urgently. The doctor will take a history, do a digital rectal exam, check your PSA, and possibly request a bladder scan to see how well you're emptying. Urine tests can rule out infection, and sometimes you'll be referred to a urologist for further investigation. So how can you manage your symptoms? Firstly, lifestyle changes like reducing evening fluid intake, limiting caffeine and alcohol, practice double voiding, which means waiting and trying to pass urine again, and bladder training exercises. In terms of medication options, there's alpha blockers like tamsulosin, alfuzosin to relax the muscle at the bladder neck and prostate as well, improving flow. Or 5-alpha reductase inhibitors like finasteride that shrink the prostate over 6 months or more. This is most effective for larger prostates. Sometimes both lifestyle changes and medications are combined together. Surgical options include something called TURB, or transurethral resection of the prostate, which is the gold standard, and there are newer minimally invasive procedures as well. BPH is common and manageable. Early treatment can protect your bladder and kidneys from complications like urinary retention or infections. Don't suffer in silence. There are effective solutions out there. If urinary symptoms are bothering you, see your GP. The earlier we address them, the more options you have, and the less disruption to your daily life.